Hi and welcome to our telehealth video information series. My name is Garvin. This video is on Testogel. So what is Testogel used for? Testosterone replacement therapy in men with low or no production of natural testosterone, which is hypogonadism. How does it work? Testogel contains the active ingredient testosterone, which is the same as the naturally occurring male hormone testosterone. Testosterone is known as an androgen. It is produced by the testicles and is the main hormone essential for normal growth and development of the male sex organs and male sexual characteristics. The natural production of testosterone is controlled by another set of hormones called gonadotrophins, which are released from the pituitary gland in the brain. During adult life, testosterone is essential for the production of sperm, the maintenance of sex drive, erectile potency, and the functioning of the prostate gland and other reproductive structures. It also has functions in the skin, muscles, skeleton, kidney, liver, bone marrow, and central nervous system. Low levels of testosterone can cause decreased sex drive, impotence, infertility, and decreased mental and physical activity, fatigue, and weakening of bones. Testosterone is given as replacement therapy when natural testosterone levels fall too low, causing problems such as those I just mentioned. Natural testosterone levels fall slowly with age and fall rapidly following surgical removal of the testicles. For example, in the treatment of testicular cancer, they may also fall due to decreased functioning of the testicles, or hypogonadism, caused by testicular disease, or by decreased gonadotrophin production by the pituitary gland as a result of pituitary disease. Testosterone replacement allows natural testosterone levels to return to normal, thus relieving the symptoms of deficiency. Testogel is applied in a thin layer to the skin. The testosterone is absorbed through the skin into the bloodstream. So how do you use Testogel? Testogel should only be applied by the man being treated. No one else should apply it for you. The gel should be applied once a day at about the same time each day, preferably in the morning. If you shower in the morning, apply the gel after doing this and once your skin has dried and cooled down. Apply the gel as a thin layer onto clean, dry, healthy, unbroken skin over the shoulders, upper arms or abdomen. Do not apply the gel to the genitals as this may cause irritation. Wash your hands with soap and water after applying the gel. Allow the gel to dry for a few minutes before dressing. If you forget to apply the gel at your usual time and it is 12 hours or more until your next application is due, then you should apply the gel as soon as you remember. If it is less than 12 hours until your next application, just leave out the missed application and apply the gel as usual when it is due next. Don't apply twice the amount of gel to make up for an earlier missed application. So this medicine is for men only. It must not be used by women or applied by women to men. Pregnant women should take particular care to avoid contact with any of the application sites on the man's skin, as the testosterone can be absorbed through the woman's skin and have adverse effects on the developing baby. If a pregnant woman does come into contact with application site or the gel, she should wash the area with soap and water as soon as possible. The side effects of Testogel: so skin reactions at the application site, such as redness, rash, itching and dryness. If you get a severe reaction to the gel, you should consult your doctor for advice. Also, acne, itching, flushing, prostate problems such as growth of the prostate gland, increased PSA levels and prostate cancer, headache, feeling sick and vomiting, mood changes, depression, nervousness, anxiety or irritability, change in sex drive, and breast pain and enlargement, persistent painful erection. And tell your doctor straight away if you experienced any of these, and decreased sperm count. How can the medicine affect other medicines? Testosterone may increase the anti-blood clotting effects of coumarin anticoagulants such as warfarin. If you are taking these, your blood clotting time, or INR, may need to be monitored more frequently. In particular, it should be measured after you start or stop testosterone treatment. If testosterone is used in combination with corticosteroids such as dexamethasone, there may be a greater risk of fluid retention and swelling. Since both medicines can cause fluid retention, this combination of medicine should be used with caution in people with heart, liver or kidney disease. If you have diabetes, your dose of insulin or anti-diabetic tablets may need to be reduced after you start treatment with this medicine. So that brings this telehealth video to an end. If you have any questions, you can leave them in the comments below or contact me through the website mytelehealth.info or call into us at Lynch's Pharmacy in Douglas and Cork or ring us 021 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.